If you've been told that walking or yoga are great for strengthening your spine, I've got some bad news for you. They don't work the way you think. In fact, research shows that postmenopausal women who only walk actually lose bone mass just slower than those who do nothing. So what does work? That's exactly what we'll cover in this video. Here's what you can expect to learn. First, we'll talk about why fracture risk depends on more than just bone density. We'll talk about walking, by how much does strength training increase bone density and reduce fracture risk. We'll discuss the top 5 exercises for the spine, where people often have the lowest T-scores. We'll also talk about strength training principles, because knowing the exercises is not enough. You have to know how to do the exercises properly in terms of frequency, amount of weight, and so on. And just as importantly, we'll talk about exercises to avoid, because it's not just about effectiveness, it's also about safety. Before we jump in, who am I? My name is Igor. I'm the author of the Amazon best-selling book called Osteoporosis Reversal Secrets. As well, I run an online personal training company that specializes in osteoporosis reversal. And just so you don't think I'm some random dude on the internet with an opinion, I'm actually a personal trainer who works one-on-one with people, seeing how the results reflect in actual humans. So here's one of my former clients. Her name is Darlene. She was a jock up until the age of 46 when she was diagnosed with breast cancer. At that point, she went through the standard treatment of chemotherapy, radiation, and eventually estrogen blockers. And as expected, but not desired, her bone density went down, and we were able to turn that around. Here is Laura, who had a long family history of osteoporosis, and in fact, she had it herself. Hers was very, very severe, and we were able to strengthen her bones by between 4 to 7%, depending on the site. And here is Anne. In this picture, Anne is 60 years old. She was fit, ate a vegan diet, and to her surprise, but not ours, she got osteoporosis. We were able to strengthen her bones as well in a matter of just 4 months of the proper approach. So let's jump in. Why does exercise matter for the spine? Because fracture risk depends on more than just bone density. Here are the other factors that affect fracture risk. One is balance. Of course, if you're more likely to fall, you're more likely to fracture something. So if your balance is good, you're less likely to fall. A bone density test does not measure your balance. Also, bone density does not affect balance. The other factor is muscle strength. And the third factor is bone architecture. That's not just bone density. It's also the interconnections between the existing bone molecules to each other. The more connected they are, the lower the risk of fractures. And again, bone density only measures, well, exactly the amount of minerals in a cubic centimeter of bone. It does not measure muscle strength, bone architecture, or your balance. So what about walking? Here's one study titled The Effectiveness of Physical Exercise on Bone Density in Osteoporotic Patients. In this study, bone was measured in postmenopausal osteoporotic women, and here were the results. Even these women who did a lot of walking still lost bone mass. They just lost it slower than women who didn't exercise. There are 4 possible things that can happen to your bone density. One, this is more than natural aging. With natural aging, women lose bone density at a rate of 1% per year. That's why not every woman develops osteoporosis. In fact, the majority don't, even at old ages. But a large minority of women, 35, 30, 38, 40, 45%, do develop osteoporosis. They lose it at 3 to 4% per year. So without walking, you lose bone this quickly. With walking, you still lose bone, you just lose it slower. But that's not good, you're still losing bone. Next is you can maintain bone. That's not good. If you have osteoporosis, you already have low bone density. You don't want to maintain low bone density. You want to increase bone density. And strength training does that. And speaking of strength training, here is a study titled Stronger Back Muscles Reduce the Incidence of Vertebral Fractures. And in this study, women were followed for 10 years. That's pretty good. Here were the results, both in bone density and in fracture risk. So strength training improved these women's bone density between 1 to 4%, depending on the woman and depending on the site, whether it's the lower back, the hip, the femoral neck, or the wrist. But more importantly, bone density is just a proxy for what really matters. What really matters is fracture risk. How likely are you to break a bone? Much more importantly is this 1 to 4% improvement in bone density had a 62.8% drop in fracture risk. Now, I don't want to say that every improvement of 1 to 4% in bone density causes this reduction in fractures. A 1 to 4% improvement in bone density from strength training causes this kind of reduction in fractures. That's not a direct relationship because, again, strength training doesn't just improve bone density, it also improves balance and it also improves muscle strength. Now, medications, yes, they do improve bone density, but they don't strengthen muscles and they don't improve balance. So that's why, despite a fairly modest improvement in bone density, the fracture risk seems disproportionate. So now that hopefully I've convinced you that strength training is very important, which exercises should you do? Here are just a few. This is especially for the spine. So back extensions, good mornings, and you can just look at the pictures, or you can check out videos on YouTube, with these exercises. Lat pull downs, a lot of people don't think of this as a spine exercise. However, the muscles called the lats, which are on the sides of the back, they flow into the lower back, so they do have a very strong effect there. Deadlifts, as well as reverse hypers and lateral bends. These 6 exercises are particularly powerful for the lower back. If you want better T-scores at the lumbar spine, these are your 6. Now, you don't have to do all of them. We'll discuss that in a second. First, just choose 1 or 2 exercises. You don't need to do all 6, okay? Any 2 are great, okay? Now, the other thing that you need to know is the dosage. When it comes to medications, dosage means milligrams, micrograms, grams, and so on. When it comes to strength training, dosage is a few different things. It's the frequency, number of days per week. It's the number of sets, it's the number of reps, and it's the amount of weight and the tempo. So that is the dosage when it comes to strength training. So how many sets do you need to do per week? You need to do between 8 to 12 sets per muscle per week. So if you just chose one of those exercises, you would need to do about 10 sets per week. If you chose 2 exercises, each one could be done for 5 sets per week, okay? The other thing to emphasize, and it's almost as if this doesn't need to be said, but I'll say it anyways, proper technique is very important. It's very important to make sure you're not getting hurt, but it's also effective. If you use the wrong technique, either you increase your risk of injury or you decrease the effectiveness of that exercise. Another important principle, this might be the most important principle, is to find a weight that you can't do more than 12 repetitions. The reason this is extremely important is because, again, the dose. If you use a dose that is too low, you could be doing the right exercise, the right intervention, but it's not going to have the effect it's supposed to. For example, if somebody's a diabetic and they're given a medication for the diabetes, but the dose is too low, it's not going to lower blood sugar. Same thing with strength training. If the dose, meaning the weight, the resistance, is too low, it's not, you have the right exercise, but the wrong dose. So you need to use the right dose, in other words, the right weight. In my experience, the vast majority of women who are exercising by themselves and have osteoporosis are way too scared to use a weight that is appropriate for them. So they, out of fear, use a weight that's too light. Okay. So the way you know it's the appropriate weight is try to do it for 12 repetitions. If you can do a 13th, it's too light. If you can do the 12th and it's a real struggle, that's the right weight. The other principle is progression. In other words, you should always ask yourself at the end of a workout, could I do, or did I do 12 reps? If you did do 12 reps, then raise the weight next workout. If you weren't able to do 12 reps despite your best effort, keep the same weight until you can do 12 reps, okay? Now, just as important as it is to know which exercises to do, it's also important to know which exercises not to do. And so one group of exercises to avoid is anything with end range spinal flexion, like crunches or sit-ups. Again, I just want to emphasize flexion and extension are okay. End range flexion and extension are not okay. So if you do crunches and sit-ups, just don't try to bring your ribs towards your hips all the way. The other exercises to avoid are hyperextensions. So things like, well, these exercises, very, very common in yoga. This really, really increases the risk of spinal fracture. And lastly, twisting with rotations should be avoided because it combines 2 motions that are not very spine friendly. One is flexion, the other is rotation. Again, they are fine as long as you don't push the end range. In this video, we just discussed strength training as a way to improve your bone density and strengthen your bones. But there are other interventions. I cover those in a special video called the Stronger Bones Checklist. 6 steps to improve bone density naturally. It includes 5 other interventions besides strength training that can strengthen your bones. This video is not available on YouTube, but it is available if you go to this link on your screen right now or in the description below. So check that out.